Welcome one and all. Myself, Dr. Tarun Prashant. Today we are going to be speaking on acute osteomyelitis. So the first thing that I come across when I hear about infection or anything related to osteomyelitis is this picture and a famous song of Jack Harrison. The word between the devil and the deep sea. So here you can see the pictorial representation of a devil as well as a ship which is going in the deep sea. So why is it that I associate myself or I associate osteomyelitis with this? It's because you're caught in two places where you wouldn't want to be. So in the same way, when a patient or any orthopedic surgeon is going to treat a patient, the last thing that he would want to see is a case of osteomyelitis. Not for anything else, but the redundancy that it can cause as a complication for the patients. So let's go in to the objectives of today's class. In today's class, we are going to first speak about definition, not just of osteomyelitis, but also a lot of other words which are usually asked in your daily curriculum. Next, to the general aspects of how an osteomyelitis or an infection outfolds. Next, to the topic in detail on acute osteomyelitis, from the etiology, what is the pathogenesis, how do the patients present to us, what are the investigations that we'd like to ask, and what is the treatment protocol that we usually follow. Going on to the definitions, you can see a huge list of words written over here. But each one of it doesn't tell you that simple or that same word called infection. It has a lot more to it. So let us go in one by one. So what is an infection? When do you call that a patient has an infection? Infection is a condition in which pathogenic organisms multiply and spread within body tissues. This is rational. This is for any part of the body that can occur, any part or any body tissue which is going to have a relative outcome due to the causative factor of the pathogenic organism which gets infested within the body. Then when do you call it as a sinus? A sinus is nothing but a blind tract, or in other words, a connection from the surface down to the tissues or a cavity which is always lined by granulation tissue which may be epithelialized. Fistula. This is the most broadly asked question. How is it different? How is fistula different from a sinus? So fistula is a communicating tract between two epithelial surfaces, whereas a sinus is a blind tract from the surface downwards. It doesn't communicate between two epithelial surfaces. And in fistula, you have two things. One, an external fistula, and the other, an internal fistula. When do you call it as an internal fistula? When the connection is between two hollow viscera, it is called as internal fistula. Whereas in case it's a connection between a hollow viscus and a skin, it is called as an external fistula. What is an ulcer? An ulcer is a break in the continuity of a covering epithelium, maybe a mucous membrane or the skin tissue in itself. So what does all this have to do with acute osteomyelitis? You need to know that when it comes to the orthopedic part of it, it's going to be very, very closely related to what we come across in your general surgery. You need to know how to confirm or make sure that you're going to come with the diagnosis of osteomyelitis when you have a lot of other things which are in common between the same microorganism which is going to cause two different pathogenesis and cause two different conditions on itself. Coming to what is osteomyelitis. Osteomyelitis is the spread of an infection due to a microorganism within the bone and the tissues surrounding the bone or within the bone, as in the bone marrow. The causative factor might be mostly due to a virulent organism or a weak host. So now coming into the other commonly asked questions, what is a sequestrum? So you need to know that in definition, there is no other answer. There is just one particular answer which is going to directly tell you what you want to say or what the pathological process has caused. Sequestrum is a fragment of necrotic bone found at the nidus of the infection within the bone, surrounded by pus and unhealthy granulation tissue. So in other words, sequestrum is dead bone surrounded by unhealthy granulated tissue. Whereas what is involucrum? The reactive new bone which gets formed following a sequestrum or any other internal debris or necrosis which occurs within the bone as a reaction which is at the layer or the interface between the diseased bone and the healthy tissue is called as an involucrum. Involucrum mostly is between the periosteal lining as well as the affected bone. So now coming to what is a glycocalyx. You need to know that glycocalyx is usually found in implants. So when a patient is going to have a fracture of a bone and when you're going to plate the bone and following plate fixation and following the surgery, within 6 weeks or something, the patient is going to return back to you with an infection. You need to be doubly sure whether it is a superficial infection or a deep infection. What happens when it's a deep infection? Do you think just a wash and a debridement is enough? Surely not. What happens is there is a mucopolysaccharide layer which is also called as a biofilm, which is synthesized by the cell wall of the bacteria. So the cell wall of the bacteria synthesizes this mucopolysaccharide, which in turn aggregates on itself and goes on multiple folds, heaping layers which prevent the antibiotic that is given to the patient to reach the affected part. So the implant creates a barrier which is in multi-folds a resistance barrier to whatever antibiotic which is given. So always when a patient is going to have infection with an implant on the inside, you must be doubly sure that the implant is not infected, or almost always it is certain that it's an infected implant and the whole pathological process will stop only when the implant is taken off. The process of taking the glycocalyx layer or this biofilm and being sent for analysis in order for identifying the organism is called as sonication. So sonication is nothing but removing the biological layer which is covered and identifying the organism which has caused this biofilm production. So the next word, what is cloaca? Cloaca is nothing but a perforation which occurs in this reactive bone of what is called involucrum that tracks down through the sinus and reaches the dead bone. So it's nothing but a connection from the surface through the involucrum and reaching the cavity where the dead bone is.